afternoon and welcome to Akash Healthcare Super Speciality Hospital's Facebook live chat session. We have with us today Dr. Ajitab Srivastav, Senior Consultant and Director, Liver Transplant, Hepatopancreatobiliary Surgery at Akash Healthcare, Dwarka. Thank you so much, sir, for joining us today. Dr. Ajitab Srivastav has more than 15 years of experience and is a renowned name in the field of HPB and liver transplant surgery. He has been a member of the team that pioneered liver transplantation in India. He has taken part in over 1,500 liver transplants, including living donor, deceased donor, pediatric, and combined liver and kidney transplants. Other complex hepatobiliary surgery, kidney transplantation, and vascular access surgery are among his specialities.
Assalomu alaykum aziz tomoshabinlar. Bugun biz Akash klinikadamiz. Akash klinikadan jonli efirdamiz va bugungi uchrashuv transplantatsiya bo'limining mana boshliq va transplantatsiya bo'limining direktor Dr. Ajitab Srivastav bilan biz mana shu Akash klinikadan jonli efirdamiz va birinchidan biz Dr. Ajitab Srivastavni tanishtirib o'tamiz. Dr. Ajitab Srivastav mana bu bo'limning direktor bo'lib va boshliq bo'lib ishlaydilar va Dr. Ajitab Srivastav da 15 yildan ko'proq tajriba bor shu sohada jigar transplantatsiya bo'yicha va bu doktor oldin ko'p operatsiyada ham qatnashganlar, 1,5 mingtadan ko'proq operatsiyada qatnashganlar, jigar transplantatsiya, o'zi jigar ko'chirib o'tkazish bo'yicha. Bundan tashqari yana boshqa pochka prisadka, buyrak almashtirganlar bunda ham qatnashganlar. Bundan tashqari vaskular o'sha tomir bo'yicha operatsiya shu bo'yicha ham qatnashganlar va Hindistonning mana jigar bo'yicha katta jamoa bor, unda ham bu a'zo bo'lib ishlaydilar. Mana biz bilan bugungi kunda Dr. Ajitab Srivastav shu bo'yicha biz hammaga xush kelibsiz deymiz va Dr. Ajitab Srivastavga ham xush kelibsiz deymiz va biz yana savollar davom etamiz, xudo xolisa.
Today, Dr. Ajitab is there with us to help us know about liver diseases and liver transplants. So, starting with a few basics, sir. What is the anatomy of liver and what are its functions?
Bugun biz bilan mana Dr. Ajitab Srivastav transplantatsiya, jigar ko'chirib o'tkazish, jigar perisadka, pechin perisadka va jigarni almashtirish uchun Dr. Ajitab Srivastav va jigarning boshqa muammolar shu bo'yicha birinchi savol hozir bizga mana Dr. Ajitab Srivastavga bo'ladi. Jigarning anatomiyasi va uning vazifalari nima?
Thank you for the introduction. Assalamu alaikum to all. Liver is a very important organ in our body. It is one of the largest solid organ and it is situated in the right upper abdomen. It has got many functions.
Jigar o'zi endi birinchi Dr. Ajitab Srivastav janoblar bizni jigar bo'yicha jigar o'zi nima? Jigar o'zi insonning tanada juda katta a'zo va juda muhim va mana jigar qorindagi mana bu qorin shu yerda qorin qovurga ustida mana bu joylashgan bo'ladi o'sha jigar.
So among the functions the liver is responsible for over 500 functions in our body, but to name the most important ones we can just to understand and to remember, it can be divided as A for albumin. Liver produces albumin which helps in retaining the fluids. B is for bile, where this is a product which is made by the liver and excreted, and when the liver turns bad, this bile gets accumulated in the body and is the result of the jaundice. C is for clotting. Liver produces factors, proteins responsible for clotting in the blood. It makes the blood thick. D is for detoxification. Many toxins in our body gets detoxified or gets cleared in our body in the liver, and then the pure blood goes to the circulation.
Endi buning vazifalar Dr. Ajitab Srivastav bizga aytib beryaptilar. Birinchidan bu jigarning faoliyat va jigar ishlab chiqaradigan buning o'zi vazifa 500 tadan ortiq deyaptilar, lekin eng muhimlar aytib beryaptilar. Masalan, birinchidan A degan masalan albumin, bu albumin ishlab chiqariladi va yana ikkinchidan B, bu ya'ni bayl degan bu o't ishlab chiqaradi. Bu jigarning eng asosiy ishdan beri shu o'zi buning faoliyatidan beri shu o't ishlab chiqariladi. Va yana uchinchidan C, clotting, bu qonni ham yaxshi qanaqa qon bo'lish kerakmi shunday bu ishlab chiqaradi. Va to'rtinchidan A, B, C va D, ya'ni ichidagi har xil modda bo'ladi jigarda. Buni yaxshi yomon moddalarni, zaharli moddalarni bu ishlab zaharli moddalarni bu chiqartiradi. Bu qonni tozalab beradigan organ bu jigar.
So, Dr. Ajitab, if the patient is suffering from any liver disease, what will be the symptoms that he will show?
So,
endi ikkinchi savol bizlarga mana jigar kasalliklarning qanaqa belgilar bo'ladi, qanaqa alomatlar bo'ladi, o'shani albatta mana bu doktordan bilamiz.
So, the liver is such an organ that it doesn't produces any symptoms until it is close to 90% damage. So once the symptoms because of the liver comes, it means that the liver has got significantly damaged. And the main symptoms for liver turning bad is jaundice. Then patient may develop water in the belly, may have vomiting of blood or passing black color stools, or may have mental status changes where they go into encephalopathy.
Mana jigar ning kasalliklarning belgilar nima? Masalan, qanday bilamiz endi jigar ishlamay qolyapti, jigar o'zini faoliyatini ko'rsatmayapti? Endi doktor aytib beryaptilar. Birinchidan jigar 90% jigar 90% yomon bo'lib ketguncha jigar hech qanaqa o'zini masalan yomon tomonga o'zgarish bo'lmaydi. 90% gacha bu ishlab turadi, umuman bilinmaydi. Doktor aytayaptilar 90% dan keyin 90% jigarga zarar tekkandan keyin belgilar, alomatlar bilinadi, boshlanadi. Birinchidan doktor aytayaptilar qorinda suv to'planadi, shishib ketadi qorin, suv to'planadi, suv yig'iladi. Ikkinchidan yana sarg'ayish, tanada sarg'ayish bo'ladi, tana sarg'ayib ketadi. Yana bundan tashqari yana qon qat chiqish shunaqa ham bo'ladi. Va yana bundan tashqari yana bitta eng asosiy muhim alomat o'zidan ketib qolish, ya'ni hushdan ketish. Shu ham alomatlar, belgilar. Bu jigar ishlamay qolgan, bu degan jigar ishlamay qolgan degan. Bu eng asosiy alomatlardan 4 ta alomat aytib berdilar.
One of the commonest symptoms for a liver disease is feeling tired, feeling fatigued, not able to do the activities daily. If such symptoms have persisted for a long period of time, अगर किसी को ये थकान, fatigue ये सब लंबे समय के लिए हो, तो it would be important कि ऐसे लोग अपने डॉक्टर से मिलें और पूछें कि लिवर का टेस्ट करके देख लें कि whether the liver is working well or not.
Endi yana aytib beryaptilar, jigar ba'zida shunaqa ham bo'ladiki, ko'pchilikda charchoqlar bo'ladi, juda tez charchab ketadi, ishtiha yo'q bo'lib ketadi, yana kuchsiz, holsiz bo'lsa, agar shunaqa alomatlar bo'lsa, ko'pincha shunaqa agar bo'lsa, shu soha bo'yicha mutaxassis doktor, jigar soha bo'yicha mutaxassis doktor bilan murojaat qilish kerak va albatta bu ham o'sha jigar ishlamay qolgan shu alomatlardan biri bo'lish mumkin deyaptilar. Bu ham shunaqa ham alomatlar ko'pincha bo'ladi deyaptilar.
So, Dr. Ajitab, what are the main reasons or causes for any liver disease and what are its risk factors?
yana hozir bizga 3-savol, qanaqa eng asosiy sabablar bor va qanaqa xavflar bor, o'shani ham albatta doktordan bilamiz.
So the main causes for chronic liver disease when the patient develops cirrhosis, liver cirrhosis, is first of all non-alcoholic fatty disease. This is really becoming like a pandemic. इनके cases काफी बढ़ रहे हैं. Then the second cause is alcoholic liver disease. The third most common is chronic liver disease because of hepatitis B and hepatitis C infection, or it could be autoimmune, where the there are antibodies against the own liver, and in around 10 to 15% of patients we may not know the exact cause of the liver disease and it is labeled as cryptogenic liver disease.
Sabablar aytib beryaptilar doktor Ajitab Shrivastava. Sabablar ko'p bo'lishi mumkin. Birinchidan masalan gepatit kasallikdan bo'lishi mumkin va yana bundan tashqari
obesity, matlab non-alcoholic fatty liver disease with alcoholic liver disease.
Keyin shunaqa ham bo'ladiki, o'zi kimdir ichadigan odamlarda shunaqa jigar ishlamay qoladi. Ba'zida ichmaydiganlarda ham shu jigar ishlamay qoladi va ba'zida doktor aytayaptilar, o'zidan o'zi insonning ba'zida shunaqa bo'ladiki, ba'zida jigar ishlamay qoladi va ba'zida 10-15% buning sabab bo'lmaydi, noma'lum sabab. Hech qanaqa sabablar yo'q deyaptilar.
Hepatitis B, C batadiye.
Eng asosiy sabablar gepatit B, C va D. Endi D ham B dan chiqadi. Kimdirda B bo'lsa B dan D ham chiqadi. Shu eng asosiy sabablar.
Okay. So now coming on to the risk factors. Risk factors, like say if the commonest cause is obesity, मोटापा, उसके रिस्क फैक्टर्स होते हैं कि अगर कोई अपना लाइफस्टाइल बहुत आरामदायक हो, सीडेंटरी लाइफस्टाइल हो, या डायबिटीज अनकंट्रोल्ड हो, या खाने में हाई कैलोरी डाइट खाए, फिर एक्सरसाइज ना करे, ये सब रिस्क फैक्टर्स है फॉर नॉन अल्कोहलिक लिवर डिजीज.
Mana kimdir ichmayotgan bo'lsa ham shu jigarga chalingan kasallik bo'lsa, masalan jigar ishlamay qolgan bo'lsa, jigarga zarar tekkan bo'lsa, jigar go'yo o'zi faoliyatni ko'rsatmayotgan bo'lsa, buning ichmayotgan bo'lsa ham bu qanday bo'ladi deyaptilar. Hozir bu savolga javob berganda doktor Ajitab Shrivastava aytayaptilar, mana qarang, ko'pchilik ko'p dam oladi va shu sababdan semiz bo'ladi. Juda buni semizlik sababdan ham shunaqa muammo bo'lib qoladi va yana semizlik sababdan va yana ko'p yana semiz va yana
और फिर उसके बाद एक तो वो एक्सरसाइज, फिर नेक्स्ट
ko'pchilik ham fitness ham qilmaydi. Shu ham katta muammolar, shu sababdan ham jigar ishlamay qoladi deyaptilar.
Okay, risk factor for hepatitis B and C is unprotected sex. मतलब फिर उसके बाद getting infected or exposed to people who are hepatitis B, C or D positive, getting exposed to the blood. फिर उसके बाद having this IV drug abusers, उनमें इसका incidence बढ़ जाता है.
Va yana bu ichmayotgan bo'lsa ham qanday jigar ishlamay qolgan bo'lishi mumkin. Yana ko'p xavf, masalan qanday xavf bor? Kimdir oldindan gepatit kasallik bo'lsa, o'sha kimdirga qon olsa, o'sha qondan yana boshqaga ham qon olsa, shunda ham jigar kasal unga ham o'tib ketish mumkin. Va yana jinsiy aloqa qilganda agar ehtiyot qilmasa, bunda ham bir-biridan o'tib ketish mumkin. Masalan gepatit kasallik o'tib ketish mumkin va bundan keyin jigarga zarar tegish mumkin va jigar ishlamay qolish mumkin deyaptilar.
So, sir, once the liver has been damaged, can this damage be reversed?
Zararlangan jigarni tiklash mumkinmi?
Yes. See, the liver damage, only once it reaches beyond the stage of fibrosis and cirrhosis, it may not be reversed. To begin with, the liver damage starts with fatty liver. then inflammation of the liver, and early fibrosis. If the corrective measures are taken till early fibrosis, the liver damage can be reversed and the liver can be completely normal.
Bu juda muhim. Zararlangan jigarni qanday tiklash mumkin? Shu savolga javob berganda doktor aytayaptilar, agar muammo boshlangan payt bo'lsa, masalan gepatit C bo'lsa yoki B bo'lsa, boshlangan payt bo'lsa, buni lecheniya qilib kontrol qilsa bo'ladi va yog' bosgan bo'lsa, jigarni yog' bosgan bo'lsa, uni ham tiklasa bo'ladi lecheniya qilib va yana ozgina shish boshqa narsa bo'lsa, o'shani ham tiklash mumkin, lekin aytayaptilar bu sirrosizga aylanib ketmagan bo'lsa, keyin buni tiklasa bo'ladi.
So, sir, talking about liver transplant now, what exactly is liver transplant?
Endi transplantatsiya nima? Endi jigar transplantatsiyasi nima va jigar ko'chirib o'tkazish, pechen perisadka va jigar almashtirish nima? Shu bo'yicha albatta doktordan bilamiz.
Once a patient having liver disease, जिन्हें लिवर डिजीज है, वो एक हद से ज्यादा जब डैमेज हो जाता है तब इन्हें लिवर ट्रांसप्लांट की जरूरत होती है. तो लिवर ट्रांसप्लांट का मतलब है कि पेशेंट का जो खराब लिवर है वो निकाल के उस जगह हम लोग एक नया लिवर डाल देते हैं.
jigar o'zi faoliyat ko'rsata olmayotgan bo'lsa va jigarga zarar tekkan bo'lsa, o'zi ko'pincha jigar a'zo o'zi katta a'zo bo'ladi tanada. Bu ko'pincha o'zi ishlamay qolgandan keyin jigarni transplantatsiya qilib, jigarni ko'chirib o'tkazish bo'lgandan keyin bu ishlatsa bo'ladi buni va bu yomon bo'lib ketgan jigarni tashlab, buning o'rniga yangi jigarni qo'ysa bo'ladi deyaptilar doktor.
So, Dr. Ajitab, are there different types of transplant as well? What are the different types of liver transplant?
Endi buning qanaqa turlari bor? Transplantatsiyaning qanaqa turlari bor? Shu ham albatta bilamiz.
So the different types of liver transplant are from the source of the organ. The patient's bad liver is taken out, उसे निकाल देते हैं, तो उस जगह हम लोग को एक डोनर से लिवर लगाना पड़ता है. तो the donor could be either live donor मतलब कोई healthy person जो related हो patient से, उनका आधा लिवर निकाल के हम लोग patient को दे देते हैं और ये लिवर जब patient में जाता है वो ग्रो हो जाता है और रिमेनिंग लिवर जो डोनर में रहता है वो भी ग्रो हो जाता है. एक तो लाइव डोनर ट्रांसप्लांट और दूसरा है कैडेवर फ्रॉम ब्रेन डेड डोनर्स.
Dr. Ajitab, our viewers would be requesting the answers in English.
In English?
Yeah.
Okay.
They'll be able to understand.
Okay, fine. So I'll repeat this. So the transplant, the various type of liver transplants are, it could be like, say, as we discussed, liver transplant is the bad liver is taken out and at the same place we put a new liver. So this new liver has to be from a source. So depending on from where is the source, it could be a live donor or from a brain dead donor. From a live donor, a healthy related person from the patient's family, we take out half the liver and we give it to the patient. The liver which is given to the patient, that grows over 6 months time, and the remaining liver which is kept with the donor, that also grows in size. So the surgery is very safe for the donor and it gives a new life to the patient recipient.
Endi buning transplantatsiyaning turlari shu bo'yicha Dr. Ajitab Shrivastava aytib beryaptilar. Qanday bo'ladi bu? Qanaqa turlar bo'ladi? Ikki xil bor deyaptilar. Birinchidan jigar beradigan o'zi haqiqiy yaqin qarindosh bo'lish kerak deyaptilar. Qon guruhi to'g'ri kelish kerak, gepatit kasallik bo'lmaslik kerak, jigarda yog' bo'lmaslik kerak. Xullas, soppoq sog' berar yaqin qarindosh bo'lish kerak jigarni berish uchun va yomon jigarni olib tashlaydi va yangi jigar qo'yiladi va yarim jigar olib qo'yiladi va bu bemorga yangi hayot go'yo boshlanadi. Bu yangi hayot beradi bu jigar almashtirish va o'zi bu jigarda yaxshi tomon jigar o'sadi va jigar tiklanadi. 6 oy ichida doktor Ajitav Shrivastava aytyaptilar, donorniki ham o'zi joyiga qaytadi va bemor o'ziniki ham joyiga qaytadi. Ikkinchi shu masalan kimdir avariya bo'lib qolsa va kimdir oldindan kimdirga masalan aytib ketgan bo'lsa, mening jigarni olsa bo'ladi, shunaqa agar variant bo'lsa, shunda ham transplantatsiya qiladi, lekin bu juda kam uchrashadigan, lekin eng ko'p haqiqiy yaqin qarindosh donor bo'lsa, xullas sopol bo'lish kerak deyaptilar.
So since we are talking about the donor only, so who can actually donate a liver for a liver transplant patient?
So the criteria for being a donor,
endi doktor shu men ham qo'shimcha aytib berdim, endi baribir shu savol yana qaytib kim donor bo'lish mumkin? Shu savolga albatta javob olamiz.
So the donor has to be an adult 18 to 55 years of age with no medical problem. Donor
qanaqa bo'lish kerakmi? Shu savolga javob berganda donor o'zi 18 yoshdan 55 yosh ichida bo'lish kerak va donorda hech qanaqa muammo bo'lmasligi kerak. Masalan, na gepatit kasallik, na jigarda yog', na boshqa muammolar, davlaniya, saxir, boshqa hech qanaqa muammo bo'lmasligi kerak. Xullas, sopol bo'lish kerak.
Should be a family member, preferably of the same group as the patient or O blood group.
Haqiqiy yaqin qarindosh bo'lish kerak va qon guruhi agar bir bo'lsa, u ham hammaga bera oladi. Yoki agar qon guruhi bir bo'lmasa, bemorniki qaysi qon guruhi bo'lsa, xuddi shunday donorniki ham bo'lishi kerak. Yoki bir qon guruhi bo'lsa, bu universal bo'ladi, hammaga bera oladi.
So the donors are evaluated in great detail, and if there is a slightest doubt that the surgery is not safe for a person who wants to donate, we don't accept a donor.
Biz birinchidan donorni polni tekshiramiz deyaptilar. Har bitta mayda-chuda tekshiruvdan ham o'tish kerak. Hamma tekshiruv bo'lgandan keyin mabodo agar biror nima muammo chiqib qolsa donorda, biror nima agar to'g'ri kelmasa, biz donorlikka qabul qilmaymiz. Chunki donorga 100% kafolat biz beramiz.
Once we accept a donor for donation, the surgery is near 100% safe, and anybody who gives part of the liver doesn't have any additional risk. Like say they have a very smooth outcome, within a week they are discharged from the hospital, and this liver which is remaining with them, this grows in size, and in the next month or so they are completely normal. In 1 week they have a normal function. In 1 month they are back to their normal self what they were before the surgery.
Donor endi ko'pchilik qo'rqadi, qanaqa qo'rqmasdan donorlik qilsa bo'ladi degan savol endi bu tug'ilyapti shu yerda. Shunga doktor Ajitav Shrivastava aytyaptilar, donor 100% donorga kafolat, donor 100% taxminan tuzalib ketadi, donorga hech nima bo'lmaydi va donor bir haftadan keyin javob beriladi va bir oydan keyin normal hayot yashasa bo'ladi deyaptilar va o'zi jigar tiklanadi, o'zi joyiga qaytadi. Hech qanaqa muammo donorga bo'lmaydi.
The remaining liver which is kept with the donor, in 3 months time it grows to the size what it was before the surgery. So because of donation, the donor doesn't have any additional risk of developing liver problem in future.
Va yana juda muhim narsa doktor aytyaptilar, chunki jigarda yaxshi tomon jigar o'sadi va jigar tiklanadi, o'zi joyiga jigar qaytadi, kelajakda ham hech qanaqa muammo bo'lmaydi deyaptilar. Jigar bergan uchun hech qanaqa zarar tegmaydi, xudo xolasa.
So Dr. Ajitav, we have an interesting question from one of our viewers, Mr. Abdul Rahman Alomda. What essential investigations need to be done in their own country before they come to India to match between the donor and recipient for choosing between 1 or 2 donors from family to avoid unnecessary costing or maybe to make it more cost effective?
Juda muhim savol Abdurrahman Rumda beryaptilar Sudandan. Katta salom yetkazaman, juda yaqin o'rtog'im. Abdurrahman Rumda aytayaptilar, donor kelishdan oldin bemor va donorning qanaqa tekshiruvlar bo'lishi kerak? Chunki kelgandan keyin to'g'ri kelmasa, yana boshqa hujjatlar qilish, boshqa juda qiyin narsa. O'shaning uchun juda to'g'ri savol beryaptilar. Donor qanaqa tekshiruvlardan o'tish kerak Hindistonga kelishdan oldin? Qanaqa to'g'ri keladigan tekshiruvlar bo'ladi? Bemorniki ham va donorniki ham shu savolga albatta javob olamiz.
So Mr. Abdul Rahman, nice question. So first of all, we need to know whether the donor has got any medical history. Secondly, we need to know the blood group of the donor, which can be done over there. Third, we can do the basic test like liver function test for diabetes, and maybe do a plain ultrasound to see if there is fatty liver or not.
Ba'zi narsalar aytib berdilar. Bu kelishdan oldin albatta tekshiruvdan o'tish kerak. Donor bo'lish uchun kim donor bo'lishi mumkin? Shunga doktor aytayaptilar, birinchidan masalan qon gruppani aniqlash kerak, qon gruppa to'g'ri kelishi kerak va yana gepatit kasallik bo'lmasligi kerak va yana LFT degan test bor. LFT degan liver function test. Bu degan jigar qanday ishlayapti, jigarning faoliyatini ham albatta bilishimiz kerak va yana bitta ultrasound, bu UZI ham qilib ko'rish kerak qanaqa nima. Agar bu hammasi yaxshi bo'lsa, albatta donorlik qilsa bo'ladi.
So one more question is there from the same viewer. How long time donor need to recover from the surgery and the size of the liver to return back to its normal size again?
Bu jigar donor jigar bergandan keyin qanchadan keyin bu o'zi hammasi tiklanadi, yaxshi bo'lib ketadi va qanchadan keyin jigar o'zi joyiga qaytadi.
So Mr. Abdul Rahman, for the donor, once we are sure that the surgery is safe, we accept a donor. After the surgery, after the first week of surgery, 97% of the donors are discharged from the hospital. Once they leave the hospital, their liver function test, which is the bilirubin, liver enzymes, PTINR, is near normal. If we do the blood test again after another 1 week, it will be perfectly normal. And the liver, it grows to the size of before the surgery. It grows in size to 3 months time after the surgery.
Dr. Ajitab Shrivastava aytayaptilar, birinchi shu qachon bemorlar hammasi o'zi joyiga qaytadi, hamma tiklanadi, o'zi bemorlar bo'ladi. O'zi operatsiyadan keyin doktor aytayaptilar, 1 hafta 10 kundan keyin hammasi joyiga tushadi va undan keyin yana bitta ikkita qon analizlar bor, jigar qanday ishlayapti va yana boshqa shunga o'xshagan yana ba'zi analizlar bor, uni ham topshirish kerak. U ham xudo xolisa yaxshi chiqadi va jigar qachon tiklanadi, nech oyda o'zi joyiga qaytadi, nech oyda o'zi o'sadi. Shu savolga javob berganda doktor Ajitab Shrivastava aytayaptilar, 3 oydan 4 oy ichida o'zi jigar joyiga qaytadi.
So now when we are much clearer about the liver transplant, we would really like you to explain the procedure to get a liver transplant done.
Endi albatta bilamiz bu transplantatsiya qanday amalga oshiriladi, shu bo'yicha ham albatta bilamiz.
So the procedure, it goes about first the recipient or the person who needs transplant is evaluated. The evaluation broadly goes into first to confirm whether he needs a transplant. Second, to know whether he is fit to undergo a transplant, where we get the detailed evaluation of his heart, kidneys and other body function. Third, we rule out whether there is any other contraindication. What I mean by contraindication is there is any factor in the patient where doing a transplant may not benefit the patient.
Endi jigar transplantatsiya uchun birinchidan jigar transplantatsiya qanday amalga oshiriladi? Shu savolga javob berganda doktor Ajitab Shrivastava aytayaptilar, birinchi biz bemor o'zini tekshirtiramiz. Har xil tekshiruvdan o'tish kerak, yurak va boshqa organlarni ham, jigarni ham tekshirish kerak, pochkani ham, bosh miyani va endi har xil tekshiruvdan o'tib, agar hammasi yaxshi chiqsa, jigardan tashqari va mayda chuda narsalar bo'lsa ham hammasi hisobga olib, o'zi bemor, o'zi kasal bu operatsiyani ko'tara oladigan holatda bo'lsa, keyin biz buni operatsiyaga qabul qilamiz. Keyin yoki दूसरा क्या था?
एक तो पहले ये जानना कि whether there is indication, second whether fitness fit for the transplant, and third is any contraindication where, like say, somebody may have cancer which is outside the liver, or heart may be so bad that it may not be fit for the surgery.
Yana bitta narsa juda muhim deyaptilar. Jigar transplantatsiya qilish kerak bo'lgan bemorda agar yurakda muammo bo'lsa, yurak yaxshi ishlamayotgan bo'lsa, yurak agar ko'tara olmasa, shu holatda biz operatsiya qilmaymiz deyaptilar. Yoki jigardan tashqari yana kimdirda jigarda o'simta bo'ladi va o'simta o'zi onkologik saraton kasallik bo'lsa, boshqa organlarga agar o'tib ketgan bo'lsa, shu holatda ham biz operatsiya qilmaymiz deyaptilar.
Okay. The next process is identification of the donor and donor fitness. The third process would be having the legal clearance between the donor and the patient, and then once we have all the clearances, then proceed with the transplant.
Mana bemordan tashqari endi baribir donorni ham tekshirishimiz kerak deyaptilar. Donorni hamma tomonlama tekshiramiz va donorniki hammasi agar to'g'ri kelsa, donor o'zi sog' bo'lsa, donorlikka olamiz va bundan tashqari endi notariusdan ham hujjatli ishlar qilinadi. Hammasi davlat tomonidan komissiya bo'ladi. Unda ham hammasi o'tadigan holatda bo'lsa, keyin mana bu komissiya notariusdan tasdiqlangan hamma hujjatlarni ko'rib ruxsat beradi davlat tomonidan. Bizda komissiyadan keyin undan keyin bemorlar transplantatsiya qilsa bo'ladi deyaptilar.
So Dr. Ajita, we have a question again from one of our viewers. How long does it take for the recipient to recover and return the liver to its normal size? And along with that, can the transplant patient live a normal life after that?
Yana bitta savol, juda ham muhim savol. Endi o'zi bemor qanchadan keyin bemalol yashasa bo'ladi va next kya tha question?
How long does it take time to recover and the liver return to its normal size?
Va yana jigar qanday o'zi joyiga qaytadi, qanday bemalol o'zi bemor o'zida qanday ishlaydi, shu savolga ham javob olamiz xudo xolasa.
So overall the success rate for this procedure is close to 97%, and it is generally seen that those people who are very sick before the transplant, they have negative outcome. If the transplant is done at a time when the patient is in better health, the outcomes are close to 100%.
Mana shu savolga javob berganda doktor aytayaptilar, bu go'yo garantiya so'rayapti, qancha garantiya beriladi. Bunga javob berganda doktor kafolat qancha bo'ladi? 97% bemor yaxshi bo'lib ketadi deyaptilar va ba'zida kimlarda jigardan tashqari boshqa muammolar bo'ladi, oldindan juda og'ir holatda keladi. Shunaqa kasallar bo'lsa, ozgina xavf ham bor deyaptilar. Har xil vaziyat bo'lishi mumkin, lekin 97% kasal tuzalib ketadi bemalol.
The liver in the recipient, it takes longer time to grow to the size what the recipient is required, size-wise. But functionally, majority of the patients after the transplant, they get discharged 2 to 3 weeks after the surgery. We ask them to stay around the hospital for another 1 month. By 3rd month, they are completely normal to resume their work, and they are completely normal. The best part of this surgery is it gives better quality of life. What the patient was not able to do before the transplant because of the liver disease is he gets back to his normal life before as if he was the way before he had liver disease.
Dr. Ajita Shrivastava aytayaptilar, o'zi transplantatsiya bo'lgan bemor, jigar ko'chirib o'tkazgan bemor, o'zi o'tkazib bo'lgandan keyin jigar o'zi ishlab ketadi va hamma narsa o'zi joyiga qaytadi. Lekin jigar o'zi joyiga qaytish, tiklash bu ozgina vaqt oladi, lekin jigar o'zi yangi qo'ygandan keyin ishlab ketadi deyaptilar va 2 haftadan 3 haftada biz klinikadan javob beramiz deyaptilar va bu bemor uchun bemalol bo'ladi, xudo xolasa hammasi. Hech qanaqa muammo bo'lmaydi.
So Dr. Ajitav, is there any special diet or special precautions that transplant recipient must follow for better outcomes? Is there any special diet or precautions that the transplant recipient must follow for better outcome?
Mana bu transplantatsiya bo'lgan bemor uchun qanaqa parhez bo'lish kerak, qanaqa dieta qilish kerak, shu bo'yicha bilamiz.
Liver transplant is a procedure which is a life-changing or gives better quality of life to the recipient, but it is very important that the person who undergoes a transplant leads a very disciplined life.
Dr. Ajitav Shrivastava aytayaptilar, jigar almashtirib bo'lgandan keyin bu go'yo yangi hayot boshlanadi va umuman hayot o'zgaradi. Normal insonlar qanday yashayotgan bo'lsa, shunday yashaydi, lekin baribir ba'zi ehtiyotlar qilishimiz kerak albatta.
So a person who has undergone a liver transplant, when I say discipline, he has to take his medicines in time. There are medicines given as after the patient gets discharged, which is immunosuppressants. It has to be taken as per the time prescribed by their treating doctors. They have to stay in touch with their team with regular tests as prescribed, so that we need to know whether the liver is taken up well with the patient.
Endi ehtiyotlar nima bo'lish kerak, shu bo'yicha aytayaptilar Dr. Ajitav Shrivastava. Birinchidan doktor aytgan narsani qilib turish kerak va doktor aytgan narsa eng muhim lecheniya. O'zi dori darmon vaqtida ichish kerak. Eng asosiy, eng muhim, masalan, pengraf, tenver, entekaver qaysi biri bo'lsa, bu vaqtida ichish kerak va har doim nimadir mayda juda narsa bo'lsa ham doktor nazoratida bo'lib lecheniyani olib turish kerak deyaptilar.
About the diet, yes, when the person is having bad liver, they are asked not to take water, salt, not to take red meat. But after a successful liver transplant, they are free to take as much water as they want. There is no restriction in the salt. They can take animal proteins, and the only thing what they need to ensure is most of the food what is taken by them has to be cooked well.
Endi ovqatlar bo'yicha Dr. Ajitav Shrivastava aytayaptilar, bu savol juda ko'p bo'ladi. Qanday ovqat yeyish mumkin, qanday parhez, qanday dieta qilish kerak? Shu savolga javob berganda Dr. Ajitav Shrivastava aytayaptilar, masalan, kim transplantatsiya bo'lgan bo'lsa, pechin perisadka bo'lgan bo'lsa, oldin masalan suv ichish mumkin bo'lmagan, suv ichish mumkin emas, masalan transplantatsiyadan oldin, va yana ko'proq tuz yeyish ham mumkin emas. Va yana bundan tashqari go'shtli narsa, go'shtli mahsulotlar mumkin emas. Lekin transplantatsiya bo'lgandan keyin bemalol xohlagan suv ichsa bo'ladi, tuz yesa bo'ladi deyaptilar va go'shtli mahsulotlar ham yesa bo'ladi deyaptilar.
So, Dr. Ajita, moving towards the end of this very interesting discussion, what are your suggestions for people who require liver transplant procedure, but they are scared to get it done?
Endi yana bitta juda muhim savol berdilar. Dr. Ajitav Shrivastava shunaqa bemorlarga nima tavsiya qiladilar? Kimda mana shu transplantatsiya qilish kerak va yoki kimdir donor bo'lish kerak, lekin qo'rqyapti. Qanday bo'ladi shunaqa katta operatsiya? Shu bo'yicha albatta bu doktorning tavsiyasini albatta olamiz.
So, well, as we know, as the years are progressing, better understanding has come about the liver transplant, science of liver transplant, and now it's quite clear that overall success rate is close to 97% after the surgery.
Bugungi kun biz ko'rib turibmiz, dunyo bo'yicha mana transplantatsiya, pechin perisadkadan keyin jigarni almashtirib bo'lgandan keyin bemorlar, o'zi og'ir bemorlar ham normal hayotga qaytyapti va bu hozirgi kunda agar biz foizni hisoblasak bu 97%gacha bo'lyapti. Bu juda katta rezultat va juda katta yutuq. O'shaning uchun qo'rqmasdan operatsiya qildirsa bo'ladi deyaptilar.
So a person who needs a transplant, if he doesn't get a transplant, his number of days are limited. Once he gets a successful transplant, he gets many years added to his life. In addition to that, it gives a better quality of life.
Juda muhim doktor Ajitov Shrivastava yana qo'shimcha qilib aytyaptilar. Mana kimda shunaqa jigar kasalga chalingan bo'lsa va agar u transplantatsiya qilmasa necha kun sanadigan kun unda bo'ladi o'zi va endi hamma xudo bergan umr yashaydi, lekin endi baribir kasallik bo'yicha agar transplantatsiya qilmasa o'zi necha kundan keyin endi xudo ko'rsatmasin olamdan o'tish mumkin. Lekin agar jigar transplantatsiya agar pechin пересадка qilsa bu o'zi necha yil o'zi yashaydi, endi xudo bergan umr yashaydi bemalol va o'zining hayot yashash tarzi ham ancha o'zgaradi, yaxshi tomonga o'zgarish bo'ladi. Hozir qiynalib yurayotgan bo'lsa, transplantatsiyadan keyin bemalol boshqa normalniy odamlar qanday yashayotgani bo'lsa, xuddi shunday yashasa bo'ladi deyaptilar. Lekin bu qachon bo'ladi? Bu transplantatsiya qildirib bo'lgandan keyin deyaptilar.
And the surgery, as we discussed, is very safe for the donor. And once a person who needs a transplant and has a donor, if he gets a transplant done in time, it would completely transform his life. So my suggestion is, if there is anybody needing a transplant, without any hesitation, come to their team, come to and consult us or consult the team who are doing transplant and get a transplant.
Endi kimda shunaqa muammo bo'lsa, kim shunaqa kasalga chalingan bo'lsa, shu soha bo'yicha mutaxassis doktorlarga murojaat qilsa bo'ladi va bizlarga ham murojaat qilsa bo'ladi va shu soha bo'yicha mutaxassis doktorlarga albatta murojaat qilsa bo'ladi deyaptilar.
So, Dr. Ajitov, we have two questions from our viewers. If we could quickly take up those. You were talking about the causes as hepatitis B and hepatitis C for liver diseases. So, once the transplant has been done, does the hepatitis issue or the disease gets cured, or it still remains in the patient's body?
Yana bitta juda muhim savol baribir tomoshabinlar tomonidan berilgan. Mana hepatit B yoki hepatit C bu baribir qonda bo'ladi va transplantatsiya bo'lgandan keyin, jigar almashtirib bo'lgandan keyin bu hepatit o'zi ketadimi yoki ketmaydimi? U qanaqa nima bo'ladi? Shu savolga albatta javob olamiz.
So it's a nice question. First of all, hepatitis B and C is the virus is there in the body of the patient, but that virus doesn't cause problem because of good medications which are available these days. The virus remains in a very inactive state in the body.
Mana hepatit B, C baribir ketmaydi deyaptilar. Bu qonda baribir bo'ladi, lekin transplantatsiya bo'lgandan keyin bu u darajada aktiv bo'lmaydi va hozirgi kunda shu hepatit uchun juda ham kuchli dori-darmon bor. O'sha dori-darmon ichib tursa, yana jigarga zarar tegmaydi.
Patient with hepatitis B will need to take medicines like entecavir, tenofovir lifelong. For hepatitis C, in case if there is any increase in the viral load, then very good oral medications have come in which won't cause any effect on the new transplanted liver. Hepatitis D, once the bad liver is taken out, hepatitis D is cured.
Juda muhim doktor Ajitov Shrivastava aytyaptilar, hepatit kimdirda B bo'lsa, shu uchun tabletkalar bor. Endi jahon standartida juda ham yaxshi effectively tenvir bor, entecavir bor va yana kimdirda hepatit C bo'lsa, shu uchun ham yaxshi dori-darmonlar bor, uni ham olsa bo'ladi. Va agar hepatit D bo'lsa, D transplantatsiyadan keyin 100% yo'q bo'lib ketadi deyaptilar.
So, taking up the last question for the session today, are there any alternatives for liver transplant for liver cirrhosis patients, or that is the last resort? Is there any alternate for liver transplant for liver cirrhosis patients, or that is the last resort?
Mana yana bitta savol, bu ham juda muhim. Agar transplantsiya qilmasa, yana boshqa nima variant bor? Transplantsiyadan tashqari, agar kimda jigarda sirrosiz bo'lgan bo'lsa, boshqa variant ham bormi yoki yo'qmi?
Unfortunately, for patients with end-stage liver disease who have got significant liver damage, liver transplant is the only solution, and right now we don't have any other alternatives for cure of such patients.
Afsus, endi shunaqa kimda kasallikka chalingan bo'lsa, baribir boshqa iloji yo'q, boshqa variant yo'q. Faqat shu oxirgi variant transplantsiya, jigarni almashtirish kerak. Jigarni o'zi pechenj пересадка qilib tiklasa bo'ladi deyaptilar. Jigar o'sha ko'chirib o'tkazish kerak, boshqa iloji yo'q deyaptilar.
Thank you so much, Dr. Ajitab. With this note, we'll wrap up the session, and thank you so much for your time and this informative session.
Endi oxirida mana Dr. Ajitab Shrivastovga chin qalbdan minnatdorchilik bildiramiz. O'zini vaqt ajratgani uchun biz juda ham minnatdormiz deyaptilar.
Thank you very much. And on this occasion, I would like all our viewers. Tomorrow is 19th April, which is celebrated as World Liver Day. All of you all take care of your liver. If you take care of your liver, the liver will stay healthy and you will lead a normal life and won't have a liver problems.
Hamma tomoshabinlarga, bizni kim ko'rib turgan bo'lsa, hamma kuzatuvchilarga Dr. Ajitab Shrivastov omad tilayaptilar va yana ertaga o'zi dunyo bo'yicha jigar bo'yicha kun belgilangan. Shu kun biz ertaga nishonlaymiz. Shu munosabat bilan albatta hamma kuzatuvchilarga tavsiya qilamiz. O'zingiz jigaringizni albatta ehtiyot qiling va bunga e'tibor bering va shunaqa qilsiz jigarda muammo bo'lmaydi va xudo xolasa shunaqa hech qachon shunaqa kasallikka ham chalinmaydi inson. O'shaning uchun o'zingizni ehtiyot qilinglar deyaptilar va omad tilayaptilar.
Thank you.